Okay, very good evening to you all. And I am going to start today our is a very common topic, that is how to get rid of dark circles or dark points or dark spots over your skin. So everybody loves color, but nobody wants the dark color over his or her skin, right over your face or over your any body part or anything. So skin is our largest organ of our body. So whatever will happen to it may cause to a dark spot may raise out of it. So what is the why the color? Color is very important. We have a face value due to color. So what is the color of different persons? Some people having whitish color, some people are having dark color, some people are having African people having more darker color, and the foreigners having more white color. So why this kind of differentiations is there? So first is your race, next is your genetics, next is your environment, how much ultraviolet light and how much sunlight we are getting. That is very important. So next important point is a pigment that is called melanin. Is the content, the number, and the amount matters much, which imparts the color white, whitish, brown, any color it imparts. The amount and the number it depends. So some people may think that why we have melanin so that we can glow more. No, but melanin as it imparts color, but in spite of that, it also gives protections from skin cancer. So we Indian people don't have skin cancer much compared to white people. Okay, so skin cancer it has a protective role. It is a two kinds of melanin is there, eumelanin and your few-melanin. So if you will get eumelanin, few-melanin ratio is more, then you will get more darker and darker. So the melanin is the main pigment. So we are getting color. So more melanins are there over your areola, over your scrotum. So you are getting dark color right over there. So next is your what kind of problem we are getting day to day life. So what kind of pigmentations you are getting, so how can you prevent it or how to treat it, and at what time you have to consult a dermatologist, you can know out of it. So first thing is your from sight, when you are going outside you are getting tanning, you are getting a hyperpigmentation or tanning you are getting. So why? Because you have melanin pigmentations. If you are getting exposed to sun, ultraviolet rays are coming and they are interacting with your melanin pigment, and the number and the quantity is increasing, and you are getting tanning over exposed part. We have seen, must have seen, your exposed part is more tan than the covered part due to your light effect, sunlight effect. Okay, nowadays your lifestyles also now is changing. You are not using laptops, mobiles, and your LED lights, all that is having different kinds of rays. So we have to protect from it, using your protective glasses you have to wear during your mobile and laptop users. You are using so rampantly mobile that rays are also causing some kinds of interactions with your face, melanin, and your whatever you applying over face cosmetics, and that produces dark circles. So let's have discussion about over your face. From your from temples area I will give an idea about it. It will be easy for you what kind of pigmentations can it be and when to consult a doctor. So the temple area, if you get pigmentations, dark color circles, dark pigmentation over temple areas, right over your these areas, then there is a terminology that is called Rills melanosis. How it appears? Nowadays different numbers of cosmetics are there. Okay, so cosmetics, if after applying every cosmetics must not be able to suit you, your skin with different skin types, everybody is having different skin types and everybody having different skin color also. So the every cosmetic will not suit everyone's. So it may suit you, it may not suit to other one. So you have to see, if you are using any cosmetics, after 15 days or 20 days people will tell you that you are going darker, or you will see in the mirror yourself that you are becoming darker. So stop that cosmetic and go to a dermatologist. Whatever damage had occurred up to your skin, that can be reversible. If you go on using that cosmetic right over months together, that may be irreversible damage to your skin. So you have to go and so to dermatologist if you are after using any cosmetic you are getting darker. So this is the real melanosis right over here. Next is your periorbital pigmentation. So it is a very common thing, periorbital pigmentation, dark circles. Okay. So first things, if you are getting dark circles, first avoid stress, get a good sleep, and get a good nutrients. So after that, if you are not getting out of it, then you see any family members, any familial predispositions is there or not. If there, then go to a doctor and say that I have a familial predispositions, what to do. Next thing is apply sunscreens over your face total along with your periorbital region. Okay. Next thing, if you are not getting right over there, then you have to test your vision test. You do a vision test. Any eye defect will stress your area periorbital pigmentation. Periorbital pigmentation may develop due to any eye vision defect. So go to an ophthalmologist, check your vision. It is 6/6 or any less than that. Then get your goggles or specs right over your eyes, and if you will get over that one. If your vision test will come normal, then you tell the dermatologist that I am vision, there is no vision defect, there is no familial predispositions, and give me a treatment. So they will give you a treatment, definite treatment, depigmenting agents and sunscreens, and you have to apply that one. Next pigmentations, let's come to your maturational dermatosis. Some kinds of people are, most of the people, not most of the people, few people are showing right over like this, and so they are getting a frictions right over at the lateral part of your malar area. So lateral part of your malar area, and that is called maturational dermatosis or your frictional dermatosis. And you have to avoid that your friction, and go to a dermatologist. He will give you the medications. The first part is what you can do, that is the prevention part. So you just avoid the friction. Next is your melasma. Here you will get the melasma. What is that? Melasma, you must have heard about that melasma. Melasma is your brown color pigmentation that will cover here a network like thing. Network like things you will get over your cheek area, over central part of nose or upper lip. So what is the cause of melasma? So these are the places you will get melasma over your face. So what is the cause? Mostly we have seen due to the hormonal causes. Most of the people are taking OC pills, oral contraceptive pills, and after exposing to the sun. And during the pregnancy period, most of the women are getting this, and we are terming it as we are naming it as a plasma. After the pregnancy period is over, some people are having persistently getting these kinds of lesions over face. We are changing the terminologies to melasma. So plasma and melasma are the same things. This is the due to mostly hormonal defects. So next thing is your why this, how to get rid of this melasma. You have to take medications to showing a doctor, and you have to avoid sun exposure. So this is the most important one. And if possible, use the contraceptives other than your pills. Next is your pigmentation part, is your perioral pigmentation. That is we are terming it as a seborrheic melanosis. So what is that? Seborrheic melanosis, if any kinds of seborrheic area, this is seborrheic area, any kinds of, you are using dabber paste, we have seen few cases there is perioral pigmentation. Any kind of allergic contact dermatitis will appear in that kind of seborrheic melanosis having idiopathic cause, and you have to go for it to a dermatologist and show it. Next thing is your freckles. So what is that? Freckles is a brownish kind of thing. It's just like a nevus kind of thing, and it will just brown color. But the melasma, how will you differentiate from the melasma and freckles? Melasma will, there will be a network like of thing over your cheek area, but freckles you will get discretely single lesion over your lower eyelids, and these will be more darker on exposure to your ultraviolet light. Next is your what? Next is your lentigens. Lentigens are also like that, and your age spot or your darker spots you will get age spot, that is called liver spot on sun exposure. So main part is your sun exposure and your melanin kind of thing. So let's go to our treatment part. Treatment part, counseling is first important, that any pigmentation dark spots will go, but you have to use it the treatment with confined to the dermatologist what treatment she or he had given. Don't go for number of cosmetics are available. Don't go rampantly that it can be, I will use this one, my friend had prescribed this one, my friend had told consulted and have get improved. No. So you first thing is sunscreen is must. So before going to sunscreen, you have to see what kind of face you have. You have the normal skin. What is the normal skin? If you are getting oil over your face, in years together in the always in the winter season or your summer season always, then your skin is oily. Okay, if you are getting dark, dry all over the seasons, then your face is dry. If sometimes you are getting oily skins, and sometimes in the years or winter season or anything you're getting dry, then your skin is normal, which is called lucky skin. So these are the skin types. If you are having the oily skins, then you have to say to the doctor that I have a oily skin, so they will give you a aqua based kind of sunscreen. Okay, if you're dry skin, then oily kind of sunscreens will give. Next thing, you have to use a minimum of SPF 30, that will cover ultraviolet A, that will protect you from ultraviolet A and ultraviolet B. So you have to use minimum SPF 30, that is sun protection factor. If you are using any cosmetic, then you have to see to the back of the it, is there written SPF or not. If you are using cosmetic with SPF, it will be much better. After that, you have to stick to the treatment and use the depigmenting agent whatever the doctors had said you. So this is and minimal treatments you can give. So let's have your questions. See, one question came it as if you have from Arijit, I think. So if you have any dark spot over your face, so what are your treatment? As I have told you, where the spot is, where you can message me also, where the spot is and what is the color of the spot, that is very important. Where you are having that spot. Okay. Any more questions? You can input your questions in the inbox, chat box. Okay, first thing is use sunscreen. Okay, sunscreen is must for your face. If you're oily skin, then go for a sunscreen that is aqua based. Okay, if you don't have that oily skin, then you go for a oily based skin sunscreen, ask a doctor and use the sunscreen. You can use any sunscreen that suits you. Okay, and in the it have to apply all over your face, just this much amount for your use this much amount of your index finger, that is the one, I think 1 inch 2 inch around, and to apply all over your face. Next is your how much how many hours you have to wait. So you have to wait for 3 to 4 hours. You are applying any one cream, and it will stay for 3 to 4 hours. Then after that it will go away or it will not act. So you have to apply 3 hours gap, 8 a.m., 11 a.m. and 2 p.m. So after that 1 month, you see what color changes you will get. After that, we can give you depigmenting agents also. If you have any more questions, please ask. Yes, first of all, if you have any dark circles, then first of you go to a ophthalmologist and check your vision. Okay, is there any vision defect or not? If you have any vision defect, then you have to use your spect with a proper power, with a adequate power. After that, after 1 month, if you're not getting out of it, then use a sunscreen in the morning. As I have discussed, in the you have to cover it to ultraviolet A and B, and you have to use 8 a.m., 11 a.m. and 2 p.m. You have to use it three times, and after that a depigmenting, or we have a dark spot. To get rid of the dark circles, we have a few many kinds of creams. You have to come to us because we have to examine the eye like this. Okay, so you have to come to a dermatologist for this. For the timing, you can use a sunscreen safely. So this is the questions from Pushpak and Giri. Okay, your doubt I think you have clear. So next is questions from your Swarup Datta. The ma'am, I am using kojic acid 2% and feeling irritations. What should I do? See, as if your skin is getting thin, applying use OTC drop. What is that OTC drop? Over the counter drop. If you are getting or using any kind of creams, as if asking from the yeah, from a shop, then you may have a damaged skin. Okay, because kojic acid 2% we have never seen irritations part. Okay, so if you are getting kojic acid 2% irritations, that your skin must have damaged at some part. If it is not, then you have to use the kojic acid 2% for 10 minutes and wash it. In the next day, increase again for 5 minutes, 15 minutes, and use for 2 to 3 days. After yeah, I mean you have to increase the durations of the application. So 15 minutes, then 20 minutes. Apply like that, then your skin will be adapted to that one and you will not get any irritations. Kojic is a very good medication. So you can use that one. Sorry. Okay. Shall we end here? Or you have any more questions? Okay, I think next questions is there. Um, Any suggestion for drag circles? Same thing I have you have repeated. You have to do a vision test. Akash, I think you have to do a vision test. After that, you have to consult. If it is normal, then you can apply any kind of medications. That is, you have to after consulting a doctor. Then next thing is vitamin E capsules and multivitamins are useful for our skin. Yes, definitely this is a very useful. You can take vitamin E medications by asking, and multivitamins are also useful. Vitamin E is definitely useful things you can take it. Yes, you can take it on regular basis, but hypervitaminosis is also there. So you can use for 1 to 2 months after that when stop. Okay, thank you. Thank you.